I'm Dr. Sepilian, a double board certified reproductive endocrine and infertility specialist. In this segment, we're going to talk about fertility preservation, specifically egg freezing or embryo freezing. Egg freezing typically is a treatment that we do in our office for individuals who want to delay their fertility to a future date. Egg freezing for many years was considered experimental and was not available for the mainstream. However, luckily, with advances in cryobiology, we can safely do it now to help individuals who want to postpone their reproductive potential to a future date. Egg freezing initially starts with an evaluation. We typically want to see that individual and evaluate to see if they're a good candidate for the process. So initial consultation usually involves either a virtual or in-person consultation where we get that patient's history, their age, their past pregnancies, if there were any, their menstrual history, any medical problems, medications that they may be on, any gynecological history or history of past infections or pap smears. We also want to know if they've had any surgeries, if there are any allergies to medications, their social history, whether they smoke, drink, or use any recreational substances, and what do they do for work and any other occupational potential exposures. Of course, we also want to know that individual's family building plans. When do they foresee themselves, if they know that they would start having children, and of course how many children they plan on having, because that may impact how we counsel and how proactive we make the treatment plan accordingly. Now, after the consultation, we do want to do a pelvic ultrasound to make sure that the ovaries are easily accessible, that we can do the procedure safely. We also want to determine the ovarian reserve, how many eggs there are in the ovaries, which can be done through a set of blood tests, as well as by visualizing the ovaries and counting the eggs that are there in the ovaries. Now, once we have determined that this patient is a good candidate for the egg freezing process, then we come up with a timeline that works for that patient, and we put the treatment protocol in place. Typically, the egg freezing process starts with the beginning of the period. There are a number of protocols that we use. Some protocols entail using a short course of birth control pills that may help synchronize all the eggs. Other protocols don't. Which protocol we use exactly will be determined on a case-by-case basis. Now, typically the stimulation part, which allows us to have the ovaries give us as many eggs as they possibly can that month, starts with the beginning part of the cycle, with the onset of menses from the beginning part of the period. Usually from day 2 or day 3, that patient will start on the stimulation medications. These are most of the time injections that are taken, and every 3 or 4 days we do an ultrasound and or a blood test to make sure that we have an adequate number of eggs that are growing, and that also they are growing adequately, not too fast, not too slow. If there are any adjustments to the dosage that need to be done, we do so at that point. And typically it takes about 10 to 12 days for the eggs to reach to the level where they are deemed to be mature, at which point we give the final trigger shot. And approximately 36 hours later, we take that patient to the procedure room to remove the eggs, or do the egg retrieval procedure, as we call it. The egg retrieval procedure is done in our accredited operating room. It is an outpatient procedure that's done under sedation, so the patient will not feel any pain or discomfort. It typically takes about 10 to 15 minutes, depending on how many eggs there are. A second physician will be present, who's a board-certified anesthesiologist, who will be there to make sure that that patient is fully comfortable, free of any pain or discomfort, and also that is breathing and is completely safe environment. Once the eggs are out, at that point, then the eggs are frozen. The patient typically wakes up in the recovery room. If she's able to eat and drink something, is free of pain, able to use the restroom, walk around, then we send her home. Typically, a few days later, we have a follow-up conversation to check on the patient to see how they're doing. We'll also let them know the final number of eggs, mature eggs, that were frozen. And if there's any need for further management or to consider to do another cycle to freeze more eggs, depending on how many and how many children that individual plans on having, we can make that decision accordingly. There are two main factors that determine the prognosis as it pertains to frozen eggs. By prognosis, I mean the probability that those frozen eggs will result in a live birth. Number one factor is age of that person when we froze the eggs. So typically age isn't a variable. Unfortunately, we can't take one's age and make it younger. The younger one freezes their eggs, the higher the probability that those eggs are going to be healthy and result in a live birth. The second factor is how many eggs they freeze. So typically, the more mature eggs that there are at any age, the higher the probability that within those eggs, there are going to be some healthy ones that are going to result in a healthy embryo and subsequently to a healthy pregnancy and a live birth. Of course, there are some predictive models that we use to help counsel the patient, and this is a discussion that we'll have when that patient is in our office, depending on their needs, depending on how old they are, what their ovarian reserve is, and how many children they plan on having. We're able to come up with a treatment plan and move accordingly. Now, in some cases, a woman or a couple who wants to do fertility preservation opt to fertilize the eggs. It could be an individual who is going to be using a sperm donor, or it could be a couple who is wanting to preserve their fertility to have children subsequently some years down the line, in which case we do the same process, but at the day of the egg retrieval, instead of freezing the eggs, we fertilize them with the sperm. We allow those fertilized eggs to grow until they're at the blastocyst stage, which typically takes 5, 6 to 7 days, at which point we either test the embryos and freeze them or just freeze them to be used at a subsequent date. I hope this was helpful. This segment was about egg freezing. Please feel free to reach out to me through our website or call us. We can set up a consultation, whether virtually or in person. We can discuss this or any other fertility topic and see how we can help you. Thank you.